In Chapter 2, we look at the Canadian healthcare delivery system. Nursing and nurses are essential to the healthcare delivery system, so understanding this system and how care is provided within it is imperative. Nurses are an essential part of the Canadian healthcare delivery system. In 2019, there were 439,975 regulated nurses. These are nurses who are eligible to practice. While the growth of eligible nurses to practice was approximately 1.9% from 2018 to 2019, the nursing workforce, those who are actually employed, was diminished by 1.5% from 2018 to 2019. Meanwhile, the Canadian population has grown by 1.4% during the same time period. As you can see, this is leading to a bit of an issue, a nursing shortage. A key component of the Canadian social safety net is Medicare. Medicare is what makes the Canadian healthcare system unique. It is considered a national program, and it provides hospital and medical insurance and is funded by general taxation. But each province and territories have different ways of providing reasonable prepaid access to the necessary hospital and physician services to all citizens and permanent residents. There is much debate around the cost, effectiveness, and sustainability of Medicare. However, principles of the Canada Health Act, accessibility, and not having to pay for healthcare are definite advantages of Medicare. The Canada Health Act, which was established in 1984, has 5 principles that guide our healthcare system. The first is public administration. This means that provincial and territorial plans operate on a non-profit basis through a public authority. Comprehensiveness means coverage for medically necessary services. This includes hospital and physician services. However, services outside of this are deemed medically necessary by each province and territory. Universality means free of discrimination based on race, gender, income, ethnicity, or religion. Portability allows insured residents access to healthcare services in other provinces and territories without cost or penalty. Insured residents in this case excludes members of the Canadian Armed Forces, the RCMP, eligible veterans, inmates in federal prisons, and Indigenous people. These individuals receive coverage and comprehensive care from the federal government. Finally, the 5th principle is accessibility. This provides insured residents reasonable access to healthcare facilities and providers based on medical need, regardless of an ability to pay. The role of the federal government in the Canada Health Act is to set and administer national principles. They assist in financing of healthcare services through transfer payments to the provinces and territories, and they also deliver health services for uninsured residents, and this includes Indigenous people, veterans, federal inmates, and members of the RCMP. They also provide national policy and programming to promote health and prevent disease. The provincial and territorial governments also play a role in the Canada Health Act and delivery of the healthcare system. They develop and administer their own healthcare insurance plans. They also manage, finance, and plan insurable healthcare services and delivery and ensure that this aligns with the Canada Health Act principles. They're also allowed to organize and determine the location of hospitals or long-term care facilities, employ healthcare providers in various specialties, and determine the amount of money dedicated to healthcare services. And while the federal government funds Medicare, provincial and territorial governments are responsible for reimbursing physician and hospital costs and some rehab and long-term care services. Most health professions hired in our healthcare system are self-regulated. This includes us as nurses, recreational therapists, occupational therapists, physical therapists, midwives, speech and language pathologists, so on and so forth. These self-regulated professions manage their own standards, competencies, code of ethics, and disciplinary actions for their members. For nurses, this would be the BCCNM, and the CNA. Some health professionals are regulated through governments and other regulatory mechanisms. For example, physicians are regulated by the government. A common point of debate regarding the Canadian healthcare system is the cost. Total healthcare spending in Canada was $265.5 billion in 2019. This is approximately $7,064 per Canadian. Canadians pay directly or indirectly for every aspect of our healthcare system through a combination of taxes, payments to government, private insurance premiums, and some out-of-pocket fees. Hospitals, drugs, and physicians are the three largest health spending categories in our healthcare spending. As of early October 2020, COVID-19 related health funding announced by both federal and provincial and territorial levels of government amounted to more than $29 billion. From March to June of 2020, the COVID-19 pandemic contributed to increased spending as additional resources were needed for PPE, ICU ventilators, and longer stays in ICU beds. When we look at the evolution of Canada's healthcare system, there have been many trends. There are two influential national reports on Canada's healthcare system reform, which were both released in 2002. The Kirby report stressed the need for cooperation among all stakeholders to reduce problems of maldistribution, undersupply, and jurisdictional competition. Meanwhile, the Romano Commission recommended changes to ensure the long-term sustainability of Canada's healthcare system. Regionalization was intended to streamline health services, reduce fragmentation, respond to local needs, improve public participation, and address the continuum of healthcare. Health authorities formed within each province. In British Columbia, there is 5 health authorities. They include Fraser Health, Interior Health, Northern Health, Vancouver Island Health, and Vancouver Coastal Health. However, this process hasn't lived up to its potential. The current trend now is toward re-centralization, which entails reducing the number of health authorities. For example, Alberta has transitioned to one health authority called Alberta Health Services. Emerging medical technologies is another approach to changing healthcare delivery. This includes new diagnostic technologies such as point-of-care testing instead of sending tests to lab, which requires processing time. An example of this would be CBGMs, or capillary blood glucose monitoring. This is a point-of-care test to check blood sugars on a patient on the floor instead of having to have lab come up and draw a blood sample and wait for the results. The 10-year plan to strengthen healthcare is meant to increase the efficiency and sustainability of the Canadian healthcare system. And in 2017 to 2018, a new federal funding model was introduced as part of the Canada Health Act, and this addressed which parts of government were paying for what. The federal government committed more money towards home care, mental health, medications, and the use of technology in healthcare. Primary healthcare is a foundation of Canada's healthcare system. It provides an entry point of contact into our healthcare system, and it allows for continuity of care. Continuity of care is concerned with the quality of care patients receive over time. It is a process in which patients and his or her physician-led care team are cooperatively involved in the ongoing healthcare management towards a shared goal of high-quality, cost-effective medical care. Primary healthcare is a model for improving health that supports essential healthcare services with a strong emphasis on health promotion and disease prevention. It is, however, important to clarify the distinction between primary care and primary health care. Primary care focuses on personal health services, whereas primary health care extends beyond primary care to include health education, nutrition, maternal and child health care, family planning, immunizations, and control of endemic diseases. Primary healthcare works the system to wrap services around the client. It is important that we do not use primary care and primary health care interchangeably because they are very different. Primary health care recognizes and addresses a broader range of health issues and contributing factors, and also has a wider range of strategies. If we use the terms interchangeably, then the extra that is associated with primary health care is likely to be forgotten or crowded out by the dominant primary care or primary medical care approach. There are, however, barriers to improving primary health care, and these barriers fall into three distinct levels. Individual level barriers is often a result of lack of role clarity and trust. This is often attributed to limited knowledge of other team members' knowledge, skills, and scopes of practice. An example in our healthcare system is the different levels of scope between a registered nurse and licensed practical nurse. Practice level barriers are closely linked to hierarchy issues at the level of governance and leadership. An example that comes to mind of a practice level barrier is when a manager of nurses is not a nurse herself or himself and is telling and directing nurses what to do and how to do their job without having the understanding. System level barriers include a lack of interprofessional education. This is often attributed to a lack of education and training related to interprofessional practice, collaboration, and practice. This essentially is understanding what other professions do and trusting them to do so, such as a physical therapist. The primary healthcare model describes 4 pillars. Teams includes an interdisciplinary team that delivers patient-centered care. These teams improve access through collaboration, coordination, continuity, and equity. Access means having healthcare after hours. An example of this might be a street nurse or the use of home care. Information includes technology that has the ability to improve efficiency and quality of care. An example in Northern Health is the use of PowerChart. It allows physicians to look at their patients' charts anywhere, anytime. Finally, healthy living includes strategies of prevention, chronic illness management, and self-care while recognizing factors outside of the healthcare system. This is essentially a socio-environmental approach to healthcare and considers the determinants of health. There are many different settings for healthcare delivery within our healthcare system. The institutional sector includes our hospitals, long-term care facilities, psychiatric facilities, and rehabilitation centers, while our community sector provides many mechanisms of healthcare delivery. Some that might look familiar might include public health, physicians' offices, assisted living, home care, adult day support programs, which are amazing programs that allow seniors and adults with disabilities to stay in their homes as long as possible. This might include things such as respite for caregivers. Another common aspect of healthcare delivery within the community is hospice and palliative care. This is care that is provided at the end of life. There are 5 levels of care that exist within our healthcare system. Level 1 is health promotion. Level 2 is disease and injury prevention. Level 3 includes diagnosis and treatment. Level 4 is rehabilitation, and Level 5 is supportive care. We're going to explore each of these more on the following slides. Level 1, health promotion, enables people to increase control over and improve their health. This can include things such as wellness services or promotion of self-esteem in children and adolescents. The Ottawa Charter for Health Promotion is an important document in this aspect or level of healthcare. There was 5 strategies identified in the Ottawa Charter, and they were to build healthy public policy, create supportive environments, strengthen community action, developing personal skills, and reorientating health services towards prevention of illness and promotion of health. Level 2, disease and injury prevention, includes taking prevention strategies to reduce risk factors for disease and injury. The most common and well-known type of disease and injury prevention would be immunizations. Level 3, diagnosis and treatment, is recognizing and managing the existing health problems of an individual. Level 4, rehabilitation, involves improving the health and quality of life of those facing life-altering conditions. This is often required after physical and mental illness, injury, or addiction. Finally, Level 5, supportive care. This level of care is for patients with chronic illness, progressive illness, or disability. They often receive care in long-term care homes, assisted living facilities, adult daycare centers, or home care. This can also include respite care and palliative care. Finally, Canada's healthcare system is challenged with a range of cost accelerators while in pursuit of achieving equity in care and access for all. Some cost accelerators include digital health technologies. While implementing these technologies into healthcare is expensive in of itself, some new technologies, such as drugs or diagnostic equipment, have reduced mortality and morbidity rates. This ties in with demographics. People are living longer, and when people live longer, chronic and age-related diseases increase in frequency and put a burden on the healthcare system. Another cost accelerator is consumer involvement and personalized medicine. Canadians demand a high level of quality of care. A patient might request an MRI over an X-ray, and if they are denied, they have the option to privately pay for an MRI and pay someone to read it. This has significant impact on the aim of the Canadian healthcare system, which is to provide quality care and access to care for all. If someone is able to pay for an MRI or an X-ray, whereas another person needs to wait, Canadians are receiving different access to care. While the Canadian healthcare system has many incredible aspects to it, there are definite challenges within our healthcare system as well, and I think it's important to be aware of them as a nurse, because at the end of the day, we're the ones that are delivering care in this healthcare system.